Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, let's talk about vertigo. Vertigo, yes, you're right. A symptom where a person experiences that everything around him is moving or is revolving. If you are someone who is experiencing this, make sure to watch this video till the end to understand what exactly is vertigo, why does it happen, and what is its management. So make sure to stay tuned. So first of all, if you think that vertigo itself is a condition or it's a diagnosis, you are wrong, because vertigo is not a condition itself, but it's a symptom of some problem that's present either within your middle ear or else in your brain area. Vertigo typically presents in the form of dizziness, where a person experiences that everything around his head is moving or else revolving or else spinning. And this is especially experienced when a person changes his or her position. As I mentioned, this problem happens due to a problem in your middle ear, which in medical terms we also call it as peripheral lesion, or else an central lesion where the problem exists in the brain or else central nervous system. In peripheral cause, which is the most commonest form of vertigo, there is a problem with the labyrinth present in our middle ear, which is responsible for us to maintain equilibrium with our body and the environment. What happens at this place is there are some calcium deposits that happen at the semicircular canal of middle ear. In cases where the lesion or else pathology is central or else related to central nervous system, ischemic changes, which means that lack of oxygen supply to certain areas in the brain, or hemorrhagic stroke where there is brain hemorrhage. In those times, due to these pathologies, person experiences vertigo symptom. Mostly in this problem, there is cerebellar involvement, which means an brain structure which is called a cerebellum, which is responsible for movement, equilibrium, balance, coordination gets affected. Along with vertebrobasilar system, which means the artery around the vertebrae, which starts or surrounds the area of the upper neck region, also gets affected. In those situations, the condition would be from central pathology or else from central nervous system. This problem usually affects both men and women, but women are more susceptible to develop vertigo compared to men. This has been an observation in several surveys and researches. Now the question arises, why does this vertigo happen? Well, vertigo can be of different kinds, as I already mentioned, but vertigo usually happens due to different reasons, and due to these different reasons, different conditions develop and person experiences vertigo as a symptom. One of the most common condition that gives symptom of vertigo is called benign paroxysmal positional vertigo, which means that with positional change, a person experiences dizziness, which means the person experiences dizziness or spinning due to movement. Most of the time in these cases, there are calcium deposits that happens in the semicircular canal or middle ear, which I already explained. These tiny calcium particles are dislodged from its normal location and gets collected in the inner ear, and this can happen without any reason. Second reason why person develop vertigo is due to a disease called as Meniere's disease. This condition, there is buildup of fluid which leads to changing pressure on the ear, causing the symptom of vertigo. Third condition that can give symptom of vertigo is vestibular neuritis, also called as labyrinthitis, which means there is inflammation in the labyrinth gland or else the inner ear region or else middle ear region. Along with this, even head and neck injury could be the reason why a person develops vertigo. Stroke, traits are also the reason that could lead to symptom of vertigo. Now, what does vertigo symptoms look like? Now, along with spinning, there are also few things that a person with vertigo experiences. The first symptom, as clearly mentioned, is definitely spinning, which means that everything around the head revolves. The second symptom that a person with vertigo experiences is called tinnitus, which means that there is an continuous sound that is felt inside the ear. Tilting, swaying, balance, person feels pulled in one direction. There is nausea, there is vomiting, there are abnormal jerky eye movements, there are headaches, and there are swelling, and there is sweating. With all the symptoms, vertigo can be either mild, moderate to severe. And the management of this problem also depends on first, what is the cause behind vertigo, and second, to the severity level of the vertigo. The management of vertigo usually comprises of vestibular rehabilitation, which is the most important method of recovering or else rehabilitating vertigo symptom. Second are medications, and third is surgery. Many a times, person don't need any treatment and they get rid of vertigo by on its own by compensatory mechanism of balance from other body areas. But when the condition goes severe, then the symptoms starts coming back. Vestibular rehabilitation is one of the most important and promising way to rehabilitate the patient and allow and help him to get out of vertigo. Physiotherapists are the professionals who help patients suffering from vertigo to undergo this vestibular rehabilitation program. In vestibular rehabilitation, exercise protocols or as exercise programs are designed for the patient, which are customized based on the clinical examination. This vestibular rehabilitation exercises focuses on developing adaptation and substitution strategies, which means that since there is a damage to the inner area or inner ear region which is responsible for the balance, the other substitute of balance systems like proprioception or as your joint position sense, your sensory system, your coordination, all of those factors are used as a substitute to adopt the postural changes or as postural problem that a person experiences. Program aims at improving gaze stability. Program aims at improving gaze stability, posture stability, improve vertigo, improve activities of daily living, and all this is done with the help of exercises. The exercises are aimed at training the other areas of balance system as a substitute to the affected vestibular system. These other systems are eye movement system, vision, somatosensory cues, postural strategies, and habituation. Hence, rehabilitation program for vertigo is customized and designed and needs to be designed by an experienced therapist who understands this problem, and with the help of this understanding creates a long-term exercise program for the patient. Medications are definitely used and is designed or is directed towards the aim of reducing secondary complications or secondary symptoms like nausea, vomiting. Antibiotics are given if there is infection that's present in the ear. Diuretics are given to reduce the swelling and calcium deposit that happens at the middle ear. Along with that, surgery is also an option but not a very common or else popular option. Surgery is very rarely used when the condition is very severe, person's ability to do live day-to-day life becomes affected, and at that time surgery is advised. So friends, this makes all in all and brief about vertigo. I hope you found this video informative. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video.